From Vancouver, Washington, a reminder to stay home, stay safe, and always stay informed. It's Quarantine Life with Jim Maines!
Hello everyone, and welcome to our Quarantine Life videos, and I am here with the one and only Temple Lentz. Temple, how are you?
I'm well, Jim. How are you?
Doing well. You're really dressed up. You're looking good. Looks like you're ready for a council meeting.
Well, in fact, we had one. We were supposed to have one today.
Today, we have Sara and Jodi, and I'm going to have them introduce themselves and share a little bit about what they do. They're very involved in our community on a lot of projects, and they focus a lot on senior living and senior care. And so I'm going to let them take it away. Sara and Jodi, do you guys want to introduce yourself?
My name's Jodie Zelazny, and I'm a co-founder of A Caring Closet with Sara. And my day job is I work for community home health and hospice. And so we provide home health in the home and hospice in the home, and we have a care center as well as bereavement for the community.
And I'm Sara Scheetz, and I'm the other co-founder of A Caring Closet. And I own Senior Living Locator, which helps people when they need to move into a long-term care setting, such as assisted living, memory care, adult family homes. I help them find that setting that meets their care needs and budget.
Awesome. So tell us a little bit about how A Caring Closet got started.
So A Caring Closet, we always like to say it started by accident. Jodi and I were working on a project with another organization, and one of the things that they wanted to do was have a small little closet that maybe had, a couple walkers, a couple wheelchairs, because in our jobs, we're always hearing people say, I have a resident who needs this item and they need it right away. And so we were thinking it'd be a nice, easy, if you had one number you could call and you could maybe access that equipment. So when Jodi and I hear a need like that, we have a tendency to just kind of start doing it. So before we knew it, our garages were full of this equipment, and the organization that we had been working with decided to go a different route. And at that point, we had a lot of equipment. People were hearing about us, that we were doing it. They were coming to us for equipment. And so we went to them and asked, what would you think if we just kind of took this project on and kept going with it? And that was in 2015. And so then by 2016, it continued to grow, and we became a 501c3 and an official nonprofit.
A Caring Closet has really come forward as an important resource in our community. And something that I thought was really exciting was when the COVID hit, you guys were part of the front lines for helping get resources to a lot of our elder care facilities. And it sounds like you're even expanding from the last time we talked, which was just about like protective equipment, supplies, toilet paper, all the things. So I'd love to hear more about what you did with regard to that and how you're moving forward with addressing the needs of some of our, elderly and most vulnerable citizens.
So because we both work in our day jobs, we work with so many of these long-term care facilities. We were seeing everybody was in panic mode, when COVID first hit. How do we get the PPE we need? But then it, like all of our households, how do we get toilet paper? And what we were finding is that adult family homes, which for anybody who doesn't know, an adult family home is a residential home where up to 6 seniors live. Oftentimes the owners live on site as well. They might have some supplemental care staff, but they live there too. And so they need stuff for their household, but they also need these basic things like toilet paper and paper towels, hand sanitizer for their residents as well. They would go to the store, but everything, shelves were cleared out. And so as we were hearing about this need and seeing it, we thought, well, since Caring Closet we had to close from accepting our usual donations of durable medical equipment in March. We couldn't have people coming to pick up equipment either. And so we thought, we're working from home, we've got some time. So what if we try to gather up these donations and then drop these items off as they become available to the doorsteps of these adult family homes. We're really fortunate. Our assisted livings and bigger communities that we work with, a lot of them have commercial accounts, so we checked in with them, but not only were they able to get the things they needed, when they heard about this project, they were donating to us and saying, here, we want to help out the adult family homes. We're all in this together. We need to work together, and we just want to protect our seniors. And so they were giving us hand sanitizer and sanitizing disinfectant spray and toilet paper. So it was pretty cool to watch everybody come together, and we could just kind of be that connection piece, literally drop these items off at people's doorsteps.
So what's the status now? I know that you were really ramping that up in March and into April. What's the status now? Is there more supply? Are you still working at that higher pace?
I take that. Well, I think it has slowed down a little bit, but today we're putting together some care packages that will still go out to the family homes. So there's still a need. I don't think it is as intense as it originally was, but yeah, we're still putting together care packages and taking them out.
Early on, the challenge was a lot of these owners going out and trying to buy the product. Has that become a little bit easier now that stores are supplied with more products, or are you still finding areas where there is a major need?
It's definitely better, but there's certain items that are still a major need. Hand sanitizer, although we've got some distilleries right here in Vancouver who've been awesome. So we're able to go buy, Caring Closets buying that in bulk, and then we're putting it, in smaller packages so that we can spread it out to homes, and that's more effective too. We're doing the same thing with the disinfectant spray. It's really hard. You can't get a bottle of 409 or Lysol and stuff on the shelves most of the time unless you just get kind of lucky. So we're still seeing that. Not so much the toilet paper. That seems to have slowed down, thankfully. Gloves are still a big issue. So there's a big shortage on gloves, and then masks, face masks. So we have had tremendous support from all of these people out there just sewing masks like crazy, that we've been able to provide over 1,000 masks in the month of April, and we still have more coming in. And not only were we able to help the adult family homes, but we also branched out and reached out to our in-home care agencies who have caregivers who are going into people's private residences so that they have these masks too.
You've recently started a new project with iPads. Can you tell us a little bit about that?
Yeah, so we are super excited about the iPad project, which is launching this week. A friend of mine, Pam Wazita, had actually sent me a Facebook message well over a month ago and just said, it's been keeping me up at night. I just keep thinking about these seniors who are in these care facilities, and even though they've got caregivers taking care of them, they're not getting to see their families, and their families are, worried about them, and they don't get to see their faces. And she said, I wonder if there's a way that if we could get iPads or some kind of device where people could do, FaceTime or something so that they can just see each other and talk to each other, not just through a window. At the time I was like, yeah, that would be great. I just, that's such a big, how would we get all these iPads? And just kept going around in my brain. Like we need to figure this out. And so I talked to Jodi about it. Super fortunate to receive a grant from the Ed and Dolly Lynch Fund to be able to purchase 25 iPads that are arriving today. And we are going to distribute them to the low income assisted living and skilled nursing facilities to start with. They will be all set up so that people can Zoom. So the facility will just set up a Zoom account, and their activities person or whoever the building's designated will be able to schedule these appointments with families and be able to do, Zoom calls or Skype calls, and so that they can actually see each other. The long-term care industry, they were the first ones in this quarantine. Unless you know someone, who is in a setting like that, you might not realize way before the stay-at-home, stay-in-place orders were put into effect. Long-term care kind of went down into lock mode middle of March, and most likely we're going to be the last ones to be able to come out of this. So we need to figure out a way to keep these families connected.
I know I've been hearing that some of these facilities, they may not be able to let maybe even just one family member in, possibly like at the end of August, and that's if things are going well. Are you seeing any repercussions of families not being able to go in and see them? Are you hearing stories that residents are having a hard time, a difficult time through this?
I definitely, for sure. I know some like memory care units, if they have to have a family member sit with them for 14 days. So I think with memory care, they get hit the hardest because once their family leaves, they almost feel abandoned because then they, can't have visitors and they don't really understand what's happening on top of everything else. So I think they get hit pretty hard.
There's some great things that a lot of people have probably seen on Facebook where family members can go to people's windows, and interact that way. And that's great. Especially in the memory care though, sometimes that can actually be more confusing because they're like, I see you and you're right there, but they don't understand why, their son or their daughter can't come inside and sit down next to them. And I know my own grandmother has dementia, and that's one of the things we've talked about, do we drive down there and go visit her and talk to her through the window, or is that going to be more upsetting, later for her? And so we're hoping that with these iPads, it's a little bit different because they're seeing them on video and they're able to communicate, but it hopefully won't cause, the confusion of why are you not coming inside, to see me.
So thankful, because this is an area that, we hear on the news about nursing homes and a lot of these care facilities, but having you both here today really sends more of that personal connection that this is real. It's happening right here in our community. We have a lot of families that can't see their parents or their grandparents. What needs do you guys have looking out for the next, 6 weeks as we stay and slowly kind of come out of this shelter in place order? What needs do you guys see to be the greatest, and how can people help you?
So definitely more masks, even the fabric ones, but those wear out. And I know everybody's asking for those, but even for the caregiving staff, they need them when they're going to the grocery store and they're doing things with their own families. On our Facebook page, we've posted a couple groups that they could use either fabric donations or money to purchase more fabric, or you could also donate to a caring closet and then just notate that you want it to be for fabric, and we can give that donation to those groups. And then as the iPad project launches this week, we're starting off with 25 iPads. We don't think that's going to be enough. In an ideal world, we would have every long-term care facility in Clark County, which would be close to 400. If you count all the adult family homes, you count all the assisted living, all the memory cares, they should all at least have one, so that we know everybody can have a way to connect their residents to their families. So if there's anybody that would like to help with that, that would be.
So in Clark County, we've got over 400 residents or organizations that are helping our seniors. What an amazing goal. If you guys could hit up all 400 with an iPad, would be amazing. So for that, you would need financial support. People can donate directly to your website.
Yes.
This has been a pleasure having you guys on and really hearing what's going on kind of in that front line. You guys are that frontline workers, the essential workers working with the most vulnerable in our community.
Thank you. It's really impressive to see how, the way you described, Sara, the way you described yourself and Jodi is so much what we see as far as when there's a need. You guys don't ask why or how or when, you just start doing. And so much good for our elderly population has been done because of efforts that you guys are involved in. And thank you. It's really huge. And whether you have somebody who's living in a facility now or my grandparents are no longer with us, but we went through. And so I think about what it would have been like to not be able to see them. And so thank you for doing this and for sharing it with us. And I wanted to make sure that, so you said it's on your Facebook page. So that's the A Caring Closet Facebook page, which we'll make sure, Jim will make sure we have the link to and is on there so that folks can help.
One last thing is I just want to say thank you to everybody who supported all these projects, whether it's our volunteers who've been doing the drop-offs at doorsteps, the people making the masks. There's so much that goes on behind the scenes that we don't see to make all this, happen. And it's just been incredible through this really difficult time for everybody to just watch everybody come together. And Caring Closet's really appreciative. Jodi and I are really appreciative, and thank you for letting us, spread the word.
All right. Well, thank you guys for coming on, and we will see you soon.
Thanks.
Thank you.
Okay. Bye-bye.
Bye.